reviewed the patient's chart. I gave her pain medication 30 minutes prior, and I'm going to go in to do a wound care. I note that there's no precautions on the door.
All right.
Hi, Mrs. Smith. I'm Emily. I'm your nurse today. We talked about doing your dressing change. Can you confirm your name and date of birth for me? Great. And that matches what her armband says. Are you in any pain? No? Okay, fantastic. If she was in pain, I would go through the PQRST of pain, but she's not. I guess those pain medications worked. All right. We're going to do a dressing change on you, if that's all right. It shouldn't be painful. Could be a little uncomfortable. I'm going to raise your bed. Okay, fantastic. And do you have any allergies? No? Okay, great. And I've already provided privacy. I'm going to perform hand hygiene.
All right, looks good. I'm gonna put some gauze and cover there. All right.
And before I put on my gloves, I'm going to wipe my table down.
I'm still gonna be wearing it.
Excellent. All right, I've already provided privacy. I'm just going to pull your blanket down and expose the wound a little bit, okay?
All right.
All right, fantastic.
Wound dressing pain
And I'm going to peel up the tape gently,
off the glove.
pulling the skin to make sure I don't cause any skin tears. Okay. And I'm going to peel the dressing so the patient can't see if the dressing's dirty or bloody. And as I do this, I'm going to evaluate the exudate, the quality of it. If it's purulent or anything of that nature, it's not. I'm going to lift out the packing gently. And I see that the exudate is not unusual. There's no sign of infection. I can feel that there's no sponginess around the wound. It appears to be healing well from the inside to the outside. And I'm going to throw away the dirty dressing. And at this point, if I was going to irrigate the wound, I would do so from the cleanest to the dirtiest. But that's not necessary here. I'm going to take off my gloves. I perform hand hygiene.
I'm gonna document.
Okay, that's actually good. You mentioned it.
Okay, so I'm gonna set up my supplies.
You think I did okay?
You cut everything. No, you can just go over it and see. I have to run it over my head first.
And while I'm here, I'm going to check the ordered solution, and it matches what's on the order. I'm going to make my pieces of tape. Open my AED pad. Okay. Great. And I'm going to put on a pair of clean gloves.
I'm gonna be preparing your station.
And next I'm going to measure the wound. I'm going to start with the depth because my Q-tip is still sterile. And 3 centimeters. And then the width. About 2.5 centimeters. And now the length. 14.5 centimeters. And throw away the Q-tip. All right. I'm gonna take off these clean gloves. Perfect. perform hand hygiene, and I'm going to set up my sterile field. I'm going to reach in and remove the dry gauze and place it on my sterile field. I'm going to pour my sterile solution. I'll reach in and put on my second sterile glove. And without breaking my sterile field, I'm going to squeeze the excess solution out and fluff my gauze. Okay, and I'm going to pack the wound gently. I'm going to make sure that the packing does not touch the unaffected skin so that it can heal properly. I'm going to put some dry gauze over the top. My hands are no longer sterile. I'm going to put on the ABD pad. At this point, I'm going to tape it down. Make sure it's not too tight, it's not hurting the patient. And I'm going to date, label, and initial on top of the tape and cover the client back up. Are you comfortable? Okay, fantastic. And then we'll take all my supplies.
I was thinking you were gonna do it like before you put your blood.
Area. And remove my sterile gloves. Which are no longer sterile. And I'm going to make sure the bed is locked and low. The patient has her call light. And do you need anything before I leave? You're okay? Okay, fantastic. And I'm going to perform hand hygiene and document my findings.